Well, hello, my name's Graham Swinney. I'm the medical affairs veterinarian at IDEX here in Australia. Also do some internal medicine work as well in the consulting service. I guess one question we sometimes get asked, or something we notice in pathology submissions, is the question of when do I need a history on our request forms? And I appreciate you all have really busy days at work where samples are being collected for you, and either you've got to fill out request forms or the nurses are going to do that for you. And it just seems like another task that needs to be completed before you get to the end of the day. And the temptation is, well, do I really need to do that? So I just wanted to have a brief chat about that. The truth is, there are some submissions where the history is a little less vital. I guess I probably should backtrack and say we always need, the appropriate patient information. So pet's name, owner's name, the clinic details, uh, breed, species, all that sort of thing, age, so that we've got that demographic information. But there are some samples that potentially the history is less vital. If you're submitting a non-interpreter profile on a patient that's well, the history is not as vital. But if you are submitting a profile on a patient that you would like interpretation for that CSIM in an interpreter profile, we really do need some history with that for the pathologist to try and give you the most meaningful interpretation we can. Now, the words I tend to suggest when we're looking at histories are clarity and brevity. We do not need war and peace with this, but the sorts of things we're looking for are a brief summary of the relevant historical and physical findings, if there's any therapy that you tried or any response to therapy, any relevant previous illness with that. So, an example of this might be, you know, uh, you've got all the patient demographic details, and the history might be, inappetence and vomiting for 2 days, inappetence and dehydration noticed on examination, poor response to antiemetics and fluids overnight, history of being on non-steroidals for degenerative joint disease, previous history of GI foreign body. That's all we need. We don't need pages and pages of information with that. If it's a sample such as urine, we also really do need the time it was collected, so we know the age of the sample when it's being looked at, and also the method of collection, because whether it's voided, catheterized, or a cystocentesis sample, that can sometimes change what we find on the sample. So it's important that we know that information when it comes to the interpretation. Now, when it comes to submitting samples for cytology or histopathology, this is where a situation where history is really important. Again, it can be clear and succinct, but there are certain things we need to know about cytology or histopathology samples. Where the lesion is and a description of the lesion is very important, including things like how long has it been present, have there been any changes in the lesion over time, um, has there been response to therapy, and whether the patient is showing any other clinical signs associated with the lesion. If there have been similar lesions before that have been treated, removed, whatever, it's really helpful for us to know what the diagnosis was on those lesions. Don't be afraid to put down what your clinical suspicions are with that. The pathologists are trained to take that information in and use it appropriately without it unduly influencing the diagnosis they make with that. So don't be afraid to include that information. If you've got visible lesions, it's great if we can get some photographs of that. So digital photographs of skin lesions. If you've got, say, taken bone biopsies, sending in digital copies of the radiographs for the pathologist to view with that as well. There's an email you can send that to. It's anz-caseinfo idex.com. Make sure in that email, attach the photographs, put the patient's name, the owner's name, your name, and the clinic it's coming from, so that we can then match that information up and send it to the appropriate pathologist when that sample's being processed. So just keep in mind, when we're talking about getting this history, you have the whole patient in front of you. So you have all that information together. We're only getting a tiny bit of that patient, be it a blood sample or a cytology sample or a histopathology sample. So that information you can provide us is really going to allow us to try and provide the best interpretation for you, to give you the most information so that you can make clinical diagnoses and decisions about that patient. If you have any questions, don't hesitate to reach out, but thank you very much for your time in listening.